I feel like an alien. I feel like an alien. Um, yeah, we need our translators. Sao bà ngồi xuống đây rồi? And allergies, non-allergies, 153. So go through age, always important, right? 80-year-old. Blood pressure, is that 133 or 153?
133.
Okay, that's not bad actually. That's not actually bad for a person her age. 84, that's okay. 98, so that's fine. Headache and dizziness.
Chronic headaches.
Oh God, that never can cure. Okay, so can you ask her the headaches? Talking about like where is it? The front, the sides, the back? Is it a chan? No, 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 no. What you? It sounds English. Này là tiếng Anh mà. Uh, Is that the wrong person? Rất đâu. Is this a tên? Tên là có không có đúng tên à? Oh, that's her. Okay. The heart. The blood pressure we measured. Is she on medication currently? Okay. So I mean, the medication is doing a good job. Her blood pressure is pretty good for her age, so it's normal for her age. Yeah, yeah. So she needs to keep taking the blood medication, the blood pressure medications that she's currently taking. That's good. Okay. Now, is she here for something different other than the blood pressure? Okay. Does she produce any phlegm? Uh, does she produce any secretions? Like she cough up anything, or is it dry? Good down. Yeah, that's it. That's the word. But you know, is she a smoker, or she was a? Anyone in the family? Okay. How long has it been? So okay. Does she have problems with breathing though? I mean, does she have any shortness of breath? But is that new? Yeah, you need to check. So okay. Does she have like a runny nose for does she have allergies? Like where she's outside, the flowers, the pollen causes her to cough. Does it make it worse? Okay. 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 Does she have any pain in her chest? Okay. Yeah. Does she cough up any blood? Does she cough up any blood? No. Oh, okay, that's good. Okay, so no, I'm fine. Okay, all right. Okay. Has she ever been tested for TB or anything? TB, tuberculosis. Has she been skin tested for tuberculosis or anything? I don't know. No, let me see. Okay, this is awkward putting this thing in my head. I, I can take a deep breath in. Can you take a deeper breath? One, hun. Okay. Her lungs are clear, so it's not like I don't think there's any infection. So I don't think so. Her lungs sound clear. Okay, I don't hear anything bad. So I don't think there's probably any infection. So it's more like a chronic cough or bronchitis. Does she have any runny nose? Like, does she feel like her throat is itchy that makes her cough? Because some people have what we call postnasal drip, where there's liquid that drains back in the mouth, and then it causes her to cough. Does she have any drip, like runny nose? And that's from allergies, so it's hard. I don't even know how to say it. Okay, all right. So at most anything is. Does she take any Claritin or anything for allergies at all? Like Claritin, or I don't know what they might not have that here. um, does she have a list of medications that she currently takes? It doesn't help. Okay. Does she have? I don't know if we have that medication. We have an expectorant, but we don't have anything other cough suppressant. Okay. I don't know. I mean, hey, Katrina, do we have any allergy medications? Yeah. You have Zyrtec? Okay. Okay. So I'm gonna give her try to she can try it for her allergies to help with the seasonal allergies. So when they're like I guess the flowers, the bloom, the pollen, to see if that helps with the cough, on top of what she's already taking. Okay. Yeah, I'm gonna give her medication for allergy. So she takes that like you can take it on once a day, on a daily basis, and she'll tell her what to take. Only take when she needs it. When she finds like the season changes, and that's when the flowers bloom and stuff, then she can take it to see if that helps. Okay, and then yeah, then she'll go over there to get the medication, but she's also gonna get some other medications, vitamins, stuff like that. Okay, so they're gonna give her that too over there. So she'll get a list of a package of other medications that we're gonna give to everybody that help with general stuff. Okay, okay. No, she goes to the next station there, the pharmacy over there. She takes this. Oh. So that's the most like one of the most common things I find is like patients come here is aches and pains and stuff. Unfortunately, the problem is chronic illness. It's not much we can do about it because we can't give medication that's for chronic meds because we run out. So if you treat someone with it and then you run out, what do you do?
Let's just do it again.
Exactly. So that's the problem with chronic illnesses. It's harder to treat. So a lot of the medical missions, in my opinion, they aiming on diseases that you can actually treat in a short period of time is more worthwhile. But but here we're getting other stuff too, like vitamins and stuff, because chronic medication requires chronic. Oh, okay, all right. Blood pressure's not bad for her age. Her heart rate's a little high. Did she walk here or something? So that's kind of high. So this one, if I if I measure that over there, I would be questioning it because your heart rate 94 is pretty high,
Yeah,
right?
yeah.
Tachycardia is
It's considered
considered,
80, right?
yeah, tachycardia you consider 100, right? So she's not far from it. So for her age, that's not normal. So you have to find out, okay, did she just walk here, exercise coming to here,
Yeah.
or did she, you might want to remeasure it down the line, right? Okay, she just wants to check it. Yeah, okay. Does she drink enough water throughout the day? She should be drinking she should be drinking probably 8 glasses of water a day. A lot of people that get that is because they're dehydrated. I don't know if you know that what dehydrated. Okay, so she fainted twice. Okay, so that's gonna be a hard one. The question is when does it happen? No, like when? Like is she outside when it's hot, or is it just out of the blue she just faints or pass out, or is it because she's working hard? Like I don't need to know why, when it happens. That's the problem. Does she pass out? Like she loses consciousness where she just doesn't know what happened? Every, in 2 years she fell down one time, and she doesn't even know why she fell. And then did she ear infection? Okay, so if you're working outside, basically she has to drink even extra water, right? Is she work outside on the fields or something? Is she a farmer or because if she's working outside, it, she works in the house. Yeah, that's a little harder to diagnose. So all I can do is get her vitamins and drink a lot of water. Okay. I mean, is she even? But does she sleep through the night? Like, is she's good enough sleep? Okay. So I mean, this dude is working so hard. I mean, she's gonna get tired. So she's gonna pass out. So unfortunately, I don't know if I can treat that. But all we can do is make sure that her body is up to strong enough by taking her eating properly, taking the vitamins that we're going to be giving her, and drinking a lot of fluid. Because if she knows that the urine that when she goes to the bathroom is dark yellow, that means she's not drinking enough fluid. Okay, you have enough drinking enough water when you go to the bathroom, pee, your need eye, it's light yellow, so it should be light yellow, light yeah, so yellow màu vàng mà nhạt nhạt nó mà nó đậm đậm vàng thì that means you didn't drink enough water. You understand? That's how you tell. Because when you drink a lot of water, your urine it dilutes, so it gets lighter. So that means you got enough water. So if she says she's drinking enough water, a lot of people aren't, especially if she's working hard. So especially this type of weather, you got to drink like 8 to 10 glasses of water, normal. Okay. So tell her that just monitor. That's how she can tell. If she's working, she goes to the bathroom. It's really dark. That means drink more water. Okay. Okay, so they're going to be giving her a bunch of vitamins. Make sure she takes the vitamins and sleep. Other than that, it's like, because it seems like it's more exhaustion, meaning working too hard, and she's just tired, and there's so much your body can take. So you have to make sure that you keep everything healthy by eating what properly, drinking enough fluid, and getting enough sleep. That's the only thing you can do to counter that, to make sure that you're at your peak performance, as the strongest. Okay? So there's not much. That's all you can do. Okay.
Fairly
G-
reasonable. That's just good. What?
generalized
Doctor's handwriting.
weakness. I'm also left-handed, so it doesn't help. Generalized weakness. Okay.
Alright.
So hydration and vitamins.
It's interesting that what they have written on the paper doesn't match what they tell you.
Well, that partly is a translation issue. So that's one of the biggest things I've encountered is translation. Because remember, people taking intake are not medical personnel. So the questions they ask might not be optimal.
I see.
Okay, so that's the weakness, but you do your best you can, right? So basically, like probably allergies, well, and dust. I mean, that's Vietnam, right? And headaches.
Wow.
See, now again, that's too high, right? So that's not normal. That's tachycardia, and that's really high. So one thing you can do if you want to check, you know how to take pulse manually. Check her pulse. You have a watch. Here's a timer. You can use this. So use your phone as a timer. Check her pulse to double check it, and then we can fix that because that's way too high, right? Okay. Okay. So skin uncomfortable with excess skin is uncomfortable with excess dust. So can you tell me what her problem is? This doesn't make sense to me. Okay, but does she have problems with her skin? So itchy. Oh, okay. So okay, that's good. Oh, what kind of factor? So my okay. Okay, well that's usually cotton. It's not that risky. Okay, okay. She's got headaches. How often? Is it every day? Once a week? Uh, but how about the headache? Is it no? Wait, how often? Is it? Oh, so that's different. So headache versus lightheadedness. So does she get like a little? Um, think she's gonna pass out or faint? So after she stands up for a bit, does it go away? After she waits for a little bit? So the headache when she stands up, how long does it last? So that's called like orthostatic hypotension, where you get lightheaded because look, when you stand up, what happens?
The blood, right?
Therefore, it's not enough blood to the brain. So
That causes the headache.
it can. It's see the way they interpret headache can be variable. That that's why I mentioned is it lightheadedness. See, those are medical terms, but they don't know that. They use the same term for everything.
It's just a headache for everything, so it might just be.
So to me, that's